Welcome to Landmark Home Health Care Hand Hygiene Guidelines Training Program. This is session 3 of 3. You will be required to listen and view this training program, and at the conclusion then complete a quiz to verify your attendance and your knowledge of the material presented today. Definitions. Hand hygiene is a general term that applies to either hand washing, antiseptic hand wash, alcohol-based hand rub, or surgical hand hygiene antisepsis. Hand washing refers to washing hands with plain soap and water. Hand washing with soap and water remains a sensible strategy for hand hygiene in non-healthcare settings and is recommended by the CDC, Centers for Disease Control, and other experts. Antiseptic hand wash refers to washing hands with water and soap or other detergents containing an antiseptic agent. Alcohol-based hand rub refers to the alcohol-containing preparation applied to the hands to reduce the number of viable microorganisms. Surgical hand hygiene antisepsis refers to an antiseptic hand wash or antiseptic hand rub performed preoperatively by surgical personnel to eliminate transient and reduce resistant hand flora or germs. Antiseptic detergent preparations often have persistent antimicrobial activity. Some indications for hand hygiene. Healthcare workers should wash their hands with soap and water when hands are visibly dirty, contaminated, or soiled, and use an alcohol-based hand rub when hands are not visibly soiled to reduce bacterial counts. Specific indications for hand hygiene. Hand hygiene is indicated before patient contact, donning gloves when inserting a central venous catheter and inserting urinary catheters, peripheral vascular catheters, or other invasive devices that don't require surgery. Hand hygiene is also indicated after contact with a patient's intact skin, contact with foreign body fluids or excretions, non-intact skin, or wound dressings, and after removing their gloves. Gloves should be used when a healthcare worker has contact with blood or other body fluids in accordance with universal precaution standards and guidelines. A survey question. What is the single most important reason for healthcare workers to practice good hand hygiene? To remove visible soiling from the hands, to prevent transfer of bacteria from the home to the hospital, to prevent transfer of bacteria from the hospital to the home, or to prevent infections that patients acquire in the hospital. The correct answer is number 4, to prevent infections that patients acquire in the hospital. All answers are good reasons to practice good hand hygiene. Improved adherence to hand hygiene guidelines has shown to terminate outbreaks in healthcare facilities, reduce the transmission of antimicrobial resistant organisms, and reduce overall infection rates. Selecting hand hygiene agents, what to consider. When evaluating hand hygiene products for potential use in healthcare facilities, administrators or product selection committees should consider the relative efficacy or effectiveness of antiseptic agents against various pathogens and the acceptability of hand hygiene products by personnel. Product acceptance can be affected by characteristics of the product, such as its smell, consistency, color, and the effect of skin irritation and dryness on hands. Easy access to hand hygiene supplies is essential for acceptance and use of products. Dispenser systems should function adequately and deliver an appropriate volume of product. Soap should not be added to a partially empty soap dispenser because of potential bacterial contamination of the soap. The effectiveness of hand hygiene preparations in killing bacteria. Plain soap is good at reducing bacterial counts, but antimicrobial soap is better, and alcohol-based hand rubs are the best. Healthcare-associated organisms are commonly resistant to alcohol. Do you strongly agree, don't know, disagree, or strongly disagree? The correct answer is disagree or strongly disagree. Alcohol does not kill C. difficile spores an organism that is found in hospitals. In addition, several studies have found hand washing with soap and water or with an antimicrobial soap and water to be more effective at removing C. difficile spores than alcohol-based hand hygiene products from the hands of volunteers inoculated with a known number of C. difficile spores. The primary reason hand hygiene with soap and water is not recommended for CDC prevention or C. difficile infection prevention in non-outbreak settings is that there are no studies that have found an increase in CDI or C. difficile with the use of alcohol-based hand hygiene products, or a decrease in the amount of C. difficile with the use of soap and water. Conversely, several of the studies did identify decreases in methicillin-resistant Staph aureus, or vancomycin-resistant enterococcus, or VRE, associated with the use of alcohol-based hand hygiene products. The combination of these findings and a lack of change in CDI or C. difficile, but decreases in other non-spore-forming multi-drug-resistant pathogens with the use of alcohol-based hand hygiene products are the basis behind not recommending preferential use of soap and water for C. difficile in non-outbreak settings. The ability of hand hygiene agents to reduce bacteria on hands. This graph shows that alcohol-based hand rub is better than hand washing at killing bacteria. Shown across the top of this graph is the amount of time after disinfection with a hand hygiene agent. The left axis shows the percent reduction in bacterial counts. The three lines represent alcohol-based hand rub, antimicrobial soap and water, and plain soap. Which hand hygiene method is best at killing bacteria? Plain soap and water, antimicrobial soap and water, or alcohol-based hand rub? According to the CDC hand hygiene guidelines, an alcohol-based hand rub is best at killing bacteria. The effects of alcohol-based hand rub on skin condition. Alcohol-based hand rubs are less damaging to the skin than soap and water. In the graph on the left, the blue bar shows self-reported skin health scores for persons using soap and water, and persons using alcohol-based hand rubs are depicted by the orange bar. Self-reported studies indicate participants using soap and water reported a significant increase in dryness, cracking, and irritation after 2 weeks, whereas those that used the alcohol-based hand rub reported improvement in skin dryness. Epidermal water content shows the same results as the self-reported scores. After 2 weeks of use, the skin water content decreased for those that used soap and water, resulting in drier skin as compared to those who used an alcohol-based hand rub. Which of the following hand hygiene agents is least drying to your skin? Plain soap and water, antimicrobial soap and water, alcohol-based hand rubs. The answer is, according to the CDC hand hygiene guidelines, alcohol-based hand rubs, particularly those that contain an emollient, are less drying to your skin than plain soap and water or antimicrobial soap and water. The time required for nurses to leave a patient's bedside, go to a sink, and wash and dry their hands before attending the next patient is a deterrent to frequent hand washing or hand antisepsis. More rapid access to hand hygiene materials could help improve adherence. Alcohol-based hand rubs may be better options than traditional hand washing with plain soap and water or antiseptic hand wash because they require less time, act faster, and irritate hands less often. How much time would an ICU nurse save during an 8-hour shift by using an alcohol-based hand rub instead of soap and water? 15 minutes, 30 minutes, 1 hour, 2.5 hours. The correct answer is 1 hour, based on 12 opportunities per hour for 8 hours, with a hand washing time, including walking to the sink and back, of 60 seconds per wash, and an alcohol-based hand rub time of 20 seconds per hand rub. According to the CDC hand hygiene guidelines, providing an alcohol-based hand rub at the patient's bedside will save time because the healthcare worker will no longer need to walk the sink and wash their hands. Recommended hand hygiene technique. These recommendations will improve hand hygiene practices of healthcare workers and reduce transmission of pathogenic microorganisms to patients and personnel in healthcare settings. When decontaminating hands with an alcohol-based hand rub, apply product to the palm of one hand and rub your hands together, covering all surfaces of the hands and fingers until the hands are dry. When washing hands with soap and water, wet your hands first with water, apply the amount of soap recommended by the manufacturer, and rub hands together for at least 15 seconds, covering all surfaces of the hands and fingers. Rinse hands with water, dry thoroughly with a disposable towel, and use the towel to turn off the faucet. Alcohol inflammability. Alcohol-based hand rubs should be stored away from high temperatures or flames in accordance with the National Fire Protection Agency recommendations. In Europe, where alcohol-based hand rubs have been used extensively for many years, the reported incidence of fires related to such products has been extremely low. In the U.S., there has been a report of a flash fire that occurred as a result of an unusual series of events, which included a healthcare worker applying an alcohol gel to her hands, then immediately removing a polyester isolation gown and touching a metal door before the alcohol had evaporated. Removing the polyester gown created a large amount of static electricity, and that generated an audible static spark when she touched the metal door, igniting the unevaporated alcohol on her hands. Following application of alcohol-based hand rubs, hands should be rubbed together until all the alcohol has evaporated. In other words, let it dry. C. difficile is different. Alcohol does not kill C. difficile spores. In addition, several studies have found hand washing with soap and water or an antimicrobial soap and water to be more effective removing C. difficile spores than alcohol-based hand rubs. However, the CDC has recommended and continues to recommend the use of alcohol-based hand hygiene in general situations. The combination of findings a lack of change in the C. difficile but decreases in other non-sporing-forming multi-drug resistant pathogens with the use of alcohol-based hand hygiene products are the basis behind recommending preferential use of soap and water for C. difficile prevention in non-outbreak settings. This is one of the materials distributed by the Centers for Disease Control to improve hand hygiene in healthcare settings. Buttons bearing the graphic as well as other hand hygiene promotional materials may be found at the cdc.gov/handhygiene. This concludes the Session 3 training program. Your next item of activity will be to complete the quiz that follows. Thank you.